This one and then those two for sure are going to be of importance. Okay? So let's do some manual muscle testing so that we can get a feel for what that's going to look like. Manual muscle testing. We have a grade scale of 0 to 5. 5 means that they have full strength against full resistance. So anything I give to her, she can handle and kick it. Not a big deal. 0 on the other end is that there's no evidence of a contraction whatsoever. That's such of a problem. So then we get in the middle stuff. So that's 5 is full, 0 is 0. And then 1 means you have a trace. Like if your hand's on it, you can feel some muscle contract, but it's not enough to move the limb. 2, the limb can move, but not against gravity. 3, the limb has the strength to move itself against gravity. And then 4 is going to be a very hairy kind of gray area of you can apply some resistance, but it's not full. Now, how do we assess what that means? What is full resistance? What is some resistance, but not full? What are we comparing it to? Not so much fatigue. Again, it's about direct resistance on these tests. So, how do I assess the integrity of this leg? Of one leg over the other? I compare it to the leg. I mean, so we potentially have an injured limb, and we're trying to assess its integrity, how strong it is, how good it is. So we're going to compare it to hopefully the other side, which is uninvolved with the injury, ideally, right? So anytime you do these tests, and this very much counts on your oral exam, you assess these things bilaterally. And then you grade them and say, okay, hip flexion, left side, 5 out of 5, hip flexion, right side, 4 out of 5. Now, obviously lifting against gravity at a 3 out of 5, and then full resistance at 5 out of 5, there's a lot of range in there. So you'll hear people use like a 4 minus, a 4, a 4 plus, based upon kind of how their comparison is. But there's a little bit of a gray scale within that. So let's kind of look at what some of these tests are like. So slide up for me. So we'll do hip flexion first. Hip flexion is just lifting that knee up, that leg up. So pick it up, and you're going to push down. And then check the other side. So 5 out of 5, both sides. So hip flexion, very easily, you can have them seated and just lift up. How would we move her to assess for if she didn't have full strength, if she couldn't go against full range of motion, or if she couldn't go through against gravity? How would we position her to then assess that? If she can't lift it against gravity, how do we assess that motion, but taking out the influence of gravity? What's that? Yeah, sure. Well, lying on her back, or what position lying?
On the side.
Side. When you put her on her side, then she's now lifting it sideways perpendicular to gravity, so it's not influencing. You see? So this isn't so much about memorizing that manual muscle testing book as it is really, if you just understand the motions, we can usually come up with logical solutions that get us there. So, hip flexion. So knee extension, very simple. Just stabilize one hand and then extend your knee. And we're just going to hold resistance. And then try the other side. And that's like a 2.5 out of 5. I didn't want to kick you in the face. Okay, so that's knee extension. Knee flexion, we can just do the opposite to where she's pulling back. Good, and then we go to the other side and compare, and we're going to get 5 out of 5. So, internal external rotation of the hip gets a little weird. So if I extend her leg, and I ask her to externally rotate, her femur is going to externally rotate. Her foot is going to externally rotate. Relax. If I bend her leg and ask her now to externally rotate, then she's bringing the foot up and in. So external rotation of the femur is actually pulling the foot across the midline of the body. So if I'm going to strength test this for external rotation, you want to brace against the medial side. Now push in. And that's checking my external rotators. And if I want to do internal rotation, push up. That's going to check my internal rotators. So this is the one that's kind of opposite. It's a little, it bothers people sometimes. But if you just remember that if you're here and you external rotate, it looks different than if you're here. So you can figure that out. Hip flexion, extension, knee extension, motion. Abduction, adduction. So, you on your side, please? So we were talking about hip flexion outside of the influence of gravity. So you can put her in this position, relax. You can actually cradle some of the weight to take the pressure off the adductors, or the abductors, pulling it out, and bring your leg forward. No, bring your hip forward, flex your hip. So then you could have her move it through a range of motion without gravity involved. Okay, so in this position we'll do abduction, adduction. So here, abduct your leg, lift your leg up. There you go, and then just you can do it. Muscle test. Then we'd have her switch sides and be able to grade that. Adduction, I think the easiest way to do it, relax. Put you right there. So cross that leg up and out of the way, and now she can do a straight leg raise this way. Adductors. And then you can push and resist. Now, a very cool thing about manual muscle testing is it teaches you enough about body position that if you want to start rehab, you're giving them evidence of really some of the entry-level exercises. So what we want is typically to have high repetition, low load. Well, body weight is typically low enough load that we can get them to do high reps of it. So if I need her to then work on abduction exercises, then I can say, okay, one of your first exercises tonight is lift this leg up 20 times in a row, do three sets of 20. Again, we're just trying to get blood flow to those muscles, but it's based upon manual muscle testing, pretty simply. Just isolating the action of that muscle. Okay? Now, paying attention to some biomechanics, mentioning up again for abduction. If she does this, and frequently even this will be too much weight, it'll hurt too much on a hip pull, a groin pull. So we can modify. So lift your leg up. So if that's problematic, then we can reduce that load by bending her knee. Now lift it up, and it's much, much easier. So just by shortening that lever arm, it changes some of that position. Questions? Comments? Queries? Good? Okay, on your stomach. So then we have extension. And so from here, we can do this in one of two ways. You can either do a straight leg raise here, lift up, and then we push you down. Or we can minimize the influence of the hamstrings by putting slack on them because they cross below the knee. So if we kind of shorten that joint there, now she lifts up, then we put pressure down. But it's going to isolate this a little bit more, but it's still mostly with all bigger pressure. So there's two ways to kind of go about it. All right. So palpation points, ASIS, AIIS. Recognize what originates there. PSIS, and how that's kind of your cleft to find that SI joint. Piriformis is going to go sacrum across into the greater trochanter. Your external rotators are going to be kind of that whole swath of range from here and across to the greater trochanter. And then extension is going to be largely your minimus, medius, and then maximus coming across. So there's lots to put in your head between now and then. And we need to get started because that exam is coming up. Okay? This is your focus for the next week and a half, is to make sure this first exam goes well. That's it.
I'm going to focus after I do one. Yeah.
Oh, that's probably good. Starts tomorrow after ortho. That's what I said, right? It starts tomorrow after ortho. Speaking of which, I should probably go get that test, put it into the computer system. All right. Okay. So let me actually go ahead and talk you guys through some things. We're going to talk about dermatomes and myotomes. So dermatomes and myotomes. Derma is skin, myo is muscle, right? So where the nerves come out of your back or out of anywhere in your body, you're going to have a set of them that go into the muscle. You're going to have a set that go into the skin and give us that sensation. So one thing that we want to do as practitioners, if we have an injury, is making sure that we have full sensation throughout the lower extremity or the upper extremity. We want to check the sensation that coordinates with a particular nerve. we also want to check the muscle integrity, the muscle innervation, to make sure the muscles are firing. So dermatome assessment is checking the nerve distribution by different regions of skin. Does that make sense? So lumbar spine, we have L1 through L5. And then we have S1 through S5. So lumbar, sacral, then we're going to have nerves that come off from those. So to assess for a dermatome, so the higher up is going to be where the branches come off first. So it's going to be where L1 is going to be. You're going to have sensation that pretty much goes right along the crease along the inguinal ligament. So if we're going to assess for this, we want to know two things. Can you feel light touch? And then can you feel 2-point discrimination? Can you identify that I'm touching you gently? Can you tell a difference between my two fingers? And then L2 is going to be, they're all in kind of these arcing pathways. So L1 is kind of across the crease of the hip. And then L2 is a little bit lower. L3 is here. L4 actually goes over the top of the knee. And then L5 is going to go down in through here on the inside of the leg. S1 is going to be the back of the foot up through here. And then S2 is going to go back of the knee into the back of the hamstring. So 1, 2, 3, knee for 4. L5 is going to take most of this. S1 is really going to be the back of the calf, back of the Achilles. And then S2 is going to be behind the hamstring.
And S1 is the lateral side of the foot?
Yeah, lateral side of the foot is kind of this through there. So, got it? So if you're going to do an assessment, can you feel this, 2-point L1, L2, L3, and asking that, making sure that you've got this in place. So next piece is going to be muscle testing those, the myotomes. So L1 largely is going to be hip flexion. So if you can do hip flexion, lift your leg and give some resistance, and we're assessing the fact that she has good strength for the nerves that come out of L1 which innervate your hip flexors. L2, 3, and 4 is all quadricep. So you can do leg extension. Sit up for me. So 2, 3, 4, kick out, push out, and again, that's all femoral nerve going to leg extension. So L5, we can have you pull your foot up, dorsiflex, and pull your big toe up, and I can push there. So hip flexion, L1, extend the leg, L2, 3, 4, pull the foot up, L5. We get to S1, plantar flexion, push down, and then S2 is hamstring, pull back. So it's like up, 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 and then down, down. Make sense? Kind of create a system so you're not trying to memorize so much. Flexion, knee extension, dorsiflexion, and great toe extension. And then you can do S1 is going to be plantar flexion with your calf, and then S2 is going to be hamstring. Got it? And the last piece that we would deal with is deep-tendon reflex. So like your reflex hammers that your doctors have used on you 1,000 times. I'll bring this in for next class, but there's going to be one here, patella tendon that you've had your doctor hit.
That was actually reflex.
I hit that leg.
I hit
hit myself a lot. And then we have the Achilles tendon in the back to assess for innervation of that